Welcome to our latest installment of Spartans Step Up. This web series is coordinated by the Alumni Association of Case Western Reserve University. I'm Rob Stalder, CWRU Alumni Association Emeritus Board Member. Today we will focus on the future of travel as pandemic restrictions ease. We have two alumni panelists who have experience in the travel industry. Joining us is Amy Kotkin, former director of Smithsonian Journeys educational travel program. Amy oversaw over 250 annual expert-led tours to all 7 continents. She is retired but continues her involvement with the Smithsonian as the co-chair of the institution's alumni program. Welcome, Amy.
Thank you. Great to be here.
Our panel also includes Chip Kennedy. Chip is an advisor and former chief technology officer for Tastemakers Africa, a community startup connecting Black people in the African diaspora through travel, culture, and global membership. Welcome, Chip.
Hi, thanks for having me on.
Great. I have one question for both panelists. We'll then go to questions submitted by several of you when you're registered. We received numerous questions, and we are grateful for all your questions, and we will get to as many as possible. My first question is a simple one. How did COVID-19 affect the travel industry, and what encouraging signs are you seeing that indicate travel is picking up? Amy?
Well, COVID-19 absolutely devastated the travel industry, from the mega cruise lines and the airlines to the tiny suppliers in global villages worldwide who could no longer count on tourism revenue for their livelihood. So it was absolutely and totally devastating. And it's picking up pretty slowly and sporadically. You've asked about some good signs. I think that we can point to the fact that air travel has started to climb again. There are more departures. There are just, simply more planes in the sky and more people in them. Forward bookings for cruises are really quite substantial, as well as for land tours in the group space. And, individually and as groups, countries are opening up to some degree. So I think it's going to be a bumpy ride, but there are some definitely positive signs.
Great. Thank you, Amy. Chip?
Yeah, I definitely agree with everything Amy said. It was a huge cliff if you look at the entire travel industry, any vertical, in any country that supported tourism. But something that's been interesting, not only is it coming back bumpy and slowly, as Amy said, which all indicators show, but it's reorganizing. As with any business industry that has a dramatic shift, it also means there's a dramatic change. And so from the business end, there are trends that might not affect us as travelers, but they're important to know because they'll affect how we travel. So Airbnb has taken a huge share of market from hotels. So now the whole way that hotel and housing stock will change when we travel in the future, as well as so many industries have gone remote, meaning people don't think about 2-week vacations anymore, myself included, but just think all the time of maybe they'll work from a different place. And that sort of staycation or work vacation actually has huge impacts on how the travel industry recovers, meaning there's whole workers that never consider themselves in the tourism industry that now do. You have Airbnb that changes things and a whole other pieces of the industry that will come back a lot different than we're used to them.
Great. Thank you, Chip. I will now go to the questions that were submitted by our attendees. My first few questions are for both of you. First off, are you for or against the use of a vaccine passport, and why? And Chip, we'll have you answer first.
Sure, happy to. I mean, I know from a political standpoint, this is kind of a landmine, but I think that's the unfortunate piece of it, is that it has been politicized as an issue, when in reality, if the issue is people deciding whether or not they want to be tracked a bit more while they travel in terms of their data and privacy, vaccine passports, the way they're actually implemented is not dissimilar to how we used to travel internationally before or how we travel internationally in the future. I don't know how each country will roll out. I'm not a geopolitical expert in that sense, but I know years ago, if I were to travel to Uganda, I still have to register with the State Department. I still have to get my vaccine passport for yellow fever, along a long list of other both medical and political registrations I have to do for my visa and everything like that. I see a COVID-19 vaccine passport in a global travel sense as being just another thing on that checklist, not the beast that it's sometimes played out to be, because we've already organized this in the tourism world. We already know how these documents work. This will be another document on that list. Different countries will approach it differently, of course, but I think the implementation will be a lot less scary and useful for the world than the way we talk about it now.
All right. Thank you. Amy, what are your thoughts?
I agree. I think that, first of all, it really is instructive to remember that vaccine passports aren't new, as Chip says. That I remember when I first started traveling, I had to have my little yellow card. And at that point, it had to include smallpox vaccinations, too, as well as yellow fever if I were going to several, different countries where that was an issue. So absolutely not new. And a lot of countries are already rolling them out. China has unveiled its digital vaccine passport already. Japan has announced plans to do the same. The European Union is rolling out a digital green certificate that will be useful for the members of those countries. And though the U.S. has not announced a plan for vaccine passports yet, there's certainly a lot of companies that are working on models for that. I think that clearly that's the direction that travel is going in, and we should be reconciled to that.
Okay, great. Another question for both of you. Do we need a vaccine to travel, or will it depend on the location? And kind of feel free to elaborate. And Amy, we'll have you do this one first.
It depends. These things change daily. I was just looking at entrance requirements for a lot of European countries now from people coming abroad and coming from abroad, and they don't necessarily need a vaccine. It just isn't that widely disseminated yet. But what you do need is a COVID test that's been done within the last 72 hours. That seems to be a universal. And if you look down the requirements of different countries at different times, over the past few weeks, you will see that's the constant, and others have implemented things like an automatic quarantine. Britain still has that automatic quarantine for people coming in, certainly from the U.S., although that could change any day and may change this week with Biden's visit. France today just was supposed to, if they do indeed, open themselves up to American travelers with a COVID test, but not necessarily a vaccine. So again, I think these things change every day, every week, every month, and it may be in the future that will be your vaccine passport. You'll need to do it.
Great. Thank you, Amy. Chip, what are your thoughts?
I completely agree with Amy. It depends on your location, which I think underscores what I hope people, especially when they're traveling internationally, were already thinking, which is do your research. The paradigm hasn't changed all that much. You should research a place before you go. You should know where you're going. You should know the travel requirements. There's just a little bit more to research these days. I think it was very confusing during the start of the pandemic, but the travel industry has created resources. So with the U.S. State Department, my former team would often use the United Kingdom's equivalent State Department website. They kept up-to-date resources, and there are a couple startups that have done e-visas and things like that now include all the requirements you need for COVID testing and vaccinations. So definitely do your research. But one thing to note with countries' vaccine requirements, especially if you're a tourist to another country, is what I think people don't think about is often these requirements come from a place of protecting workers in the travel industry, which is just important to note that when you're traveling, you're a visitor. And we always think about, well, what requirements do I need? What do I need to go do ahead of time? Why is there this burden? Why is this visa so difficult? And yeah, there's probably 10 million political issues that go into these equations, but a huge equation, especially where my team worked across West Africa and South Africa, these rules are in place because the tourism industry, the workers in it are trying to protect themselves. When you have unvaccinated travelers going to a country, the people who are unprotected are those who you're interacting with, your taxi driver, your waiter, your tour guide, that you're having the best time with, but they're also the most vulnerable to travelers. So you're not just protecting yourself and trying to follow the rules, but you're also doing a service to the place you're visiting, which is a huge part of the equation when you're doing this research and deciding where you want to go.
Great. Thanks, Chip. In your opinion, what are the safest destinations to start our return to travel? Do you think some modes of transportation are safer than others, and why? And Chip, we'll go to you.
Sure. I mean, I think this also it depends. Where have you always wanted to go? Obviously, COVID changes the equation, and there are some countries that aren't open to travelers right now. There are other ones that, as Amy mentioned, have mandatory quarantines that might not go away in the short term, meaning you probably don't want to spend 2 weeks of a 3-week vacation in a hotel without leaving. But most countries are not off limits. You just have to adjust your travel plans to match that country's COVID and quarantine expectations. But I don't think anyone should reshuffle their list or anyone should change where they want to go in life. Most places can work. You just have to time it, do your research, and make sure that you know what that country's COVID situation looks like and you're respectful of that situation.
Great. Thank you. Amy, your thoughts?
Well, individual responsibility, which is what Chip is alluding to, is really a big piece of it. You can see in my backdrop where I think the safest place for me is right now, and that is in my native Washington, D.C. Just as an example, personal example, my husband and I spent several months during COVID creating walking itineraries for ourselves within 45 minutes of our home. We're up to 87 different itineraries. We know Washington, D.C. better now than we ever had. Collectively, we've lived here about 80 years. So I feel, first of all, that there's no place like the vicinity in which you live to explore if you haven't done that yet. And this is coming from a travel professional of many years. But secondly, consider other domestic locations first, in that you will have access to the kind of medical care that you are used to having. You are assured of a sort of consistency, perhaps, of expectations across the board. We are, for our first trip post-pandemic, or in the waning of the past pandemic, we're going out to Yellowstone National Park. We will not be alone. That is a very popular destination right now, but that will be our maiden voyage, so to speak. And we look forward to doing international travel next year. So for safety is a really personal thing. Where you feel safe is the most important thing. And for us right now, where we feel safe is probably in this country. But we certainly look forward to expanding that repertoire. And there are certainly reasons to do that now and to look forward to international travel when there isn't as much uncertainty. As Chip said, you can certainly, navigate your way around the world, observing the COVID, restrictions. The question is, what do you want to do, and what do you feel comfortable doing?
Great, thank you. And you ought to package up those itineraries, by the way, and maybe you can sell those things. You might be able to, you might have something there. Amy, here's a question for you. Someone is planning a trip to Europe in August. What tips do you have for that person?
Okay, pack your patience, your flexibility, keep current with all of the advisories that are coming out. Stay informed, be totally flexible. Keep an eye on the State Department Travel State Gov site to see what they are saying. If I'm assuming that this person, when you're going to Europe, you're going to, various countries in Europe, you have to stay totally abreast of, entry and exit requirements by country, even though there are broad protocols that affect all of the EU countries. Temper your expectations. London and Paris are not going to be exactly the way you remembered London and Paris 2 years ago. There are going to be more restrictions. There are going to be some places, there are curfews still. France is steadily giving you more time to be out in the evening, but there's still a curfew. London has its restrictions now and could be reimposed. Even today, there was evidence that one of the variants is really taking hold there. So conditions are going to change, You need to be flexible, and you also have to remember you're not going to just walk into the Louvre or the British Museum. That's going to take a timed ticket, and it's kind of hellish to get one. But on the other hand, when you're there and you're not with a lot of crowds, that's kind of delicious. So there's just a lot of planning that needs to, and a lot of monitoring that needs to go on. But you can do it.
Great. Thank you. Chip, a viewer asks, where can one find accurate information on rates of COVID-19 and vaccination rates for countries outside the U.S.?
Yeah, absolutely. I'm guessing this is in the lens of travel, but as Amy mentioned and I mentioned earlier, there are a lot of resources online. The U.S. State Department, the CDC tracks some of this, as well as other countries are tracking the global look. I've often used the UK. There are also private companies, but to list them, one I've used a lot during the pandemic is Sherpa. So they work with American Airlines and others to do e-visas, as well as essentially you put your dates and your destination, and they're going to spit back to you the vaccination requirements, the COVID situation as it resorts to travel, and other useful information. But I would say is follow travel advice as you see it, and also use travel professionals. Amy represents traditional tour guides, which have done some really cool things. I worked for a younger travel startup that took a more marketplace approach, but both of us represented the idea of getting more information to travelers and helping them be more organized. And there's no shortage of those companies who have survived the pandemic and are continuing to offer, if not trips at the current moment, at least advice and resources. So I could shortlist so many different competitors of ours and companies that would be more than happy to help you build an itinerary or find a trip or just find more information once you've picked a destination or once you're interested in a destination. So definitely ask for help, short of just getting the information on your own. Don't be afraid to reach out and find resources through other people.
Great. Thank you so much. That's great.
I can add to that if you'd like. Yeah. I found one of the best resources day to day is the New York Times. They have done an incredible job of tracking the virus country by country, and they will give you up-to-the-minute information on what percentage of the population has been vaccinated, 1 shot, 2 shots, what their entry requirements is. And they are really, I was just looking at it again this morning, in particular for our neighbor countries, for Mexico and Canada. The border is still closed with Canada, U.S.-Canada border is still closed and will be at least until June 21st. And they don't really intend to reopen it until 70% of their population is fully vaccinated. Right now, 63% have gotten 1 shot, 8% have gotten 2 shots. So if you look at sites like that, CNN also does a very good job of tracking that day to day. You can get a really good real-time picture of what's happening country by country.
Great. Thank you. Appreciate that. Here's one last question for both of you. Could you please mention why it may be more important than ever to use the services of a travel professional versus the internet? Also, do you encourage purchasing travel insurance? Amy?
Yes and yes. I feel that in some ways, the amount of information that's now available on the internet has only made it a little bit more confusing for a consumer as to which sites to trust and which sites to look at consistently. You're bombarded with information, and it's really difficult to sort it out, I think. So my go-to solution always is to use a travel professional. Now, if you're used to group travel, and you go with, Smithsonian or Rhodes Scholar or any number of other major providers, that can be your go-to kind of concierge service. But many people as well are comfortable with a travel agent or travel consultant, as they're now usually called, or an operator that just does simply individual itineraries rather than group itineraries. I think that if you find one you really trust and are feel comfortable with, you can count on them to sort of sort through the good and the bad, the bogus from the verifiable, the reliable sources of information. And very often these people, it will have in-country suppliers and advisors who are really updating them in real time as to what the conditions are. So I think now more than ever, there is a need for good professional help when you travel. We can circle back to the travel insurance, but maybe Chip wants to also talk about travel professionals.
Oh, I appreciate that, Amy, and I think we're definitely in agreement of getting advice, and getting professional advice helps a lot. Travel insurance is absolutely important, so please consider it. And Amy, to your point, we all have personal responsibility. That should be part of the equation whenever we travel. What is the place we're traveling to? What are we comfortable with, and what is our risk tolerance, and how do we address those things? In terms of professionals, I absolutely agree with professional advice, but I did spend a lot of my career in travel working for a technology company, which I think is an interesting, slightly different viewpoint. I think there's a place for travel professionals, but what we have these days is something that's really unique and really special in the travel industry, which is this new spectrum. It is confusing. I definitely agree to that. But you have travel consultants and the higher end and group trips, which now represent often the more expensive way of traveling. But you have, when people are doing it right, much better resources for those who are trying to do travel internationally or domestically without spending as much money. And I think that there are resources there. They are confusing to find, but I've been really inspired by what I've seen, including by my former company, of this ability to democratize travel a little bit. So whether that's services to connect you directly to tour guides that you can trust and then contact them. You have Airbnb and Airbnb experiences that says what pieces of your travel can be made directly, so you can shop around and verify where you're going, but without necessarily always having to ask a professional. And then there are services that democratize the travel consultants themselves, different services, either trusted blogs or trusted reviewers that you can read about and gives you information about a place, or even travel consultants that you can bring on part-time, as Amy said, to write an itinerary. So getting professional advice is important, but what is really interesting is that professional advice is spread across a lot of different mediums now. So if the group trip doesn't fit into your schedule, or if a individual tour just isn't something you can afford, I think the travel industry is starting to accommodate all of us a lot better financially, which is excellent, as long as you're doing your research and you're trusting the sources you're asking.
Great, thanks.
Good point. Very good point. Okay, travel insurance. Well, you can see I represent a different place on the spectrum, which was great. I'm also a pretty firm believer in travel insurance because travel is a major investment, no matter, whether you do it with a professional or you do group travel or you're doing it on your own. It is, especially these days where there is so much uncertainty in travel, I feel better having some sort of policy in place. That being said, you have to be really careful with what you buy and what inclusions and exclusions it has, particularly now with COVID. There are some things that have been carved out. There are some things that have been added to policies so that, for instance, you can purchase quarantine insurance, in the sense that if you are delayed once you get to your destination in embarking on your itinerary, in some cases you can buy insurance that will protect you for that 10 days or 2 weeks that you have to quarantine. So all kinds of inclusions, exclusions now, very, very important for you to read the fine print and actually kind of game out some of the scenarios. What if I do A? What if I do B? What happens if I do get COVID while I'm traveling? Does the medical portion of your insurance actually cover that, even though COVID is a known risk? So they're very important to be able to do that. And there are a couple of really good websites that are where you can put in your itinerary and have them shop for you and get the policy that you want from the company that offers what you want. At the extreme end of insurance is this cover for any reason, cancellation insurance, which is insanely expensive, but is the right thing for some people. You're actually almost paying for a second trip to get it. So I'm not sure I would go there, but I would really look for a good policy that has great medical coverage, evacuation coverage, which is really expensive if you ever have to be evacuated because you can't get the kind of treatment you need in the location where you find yourself, and you have to be transported either back to the U.S. if you're a U.S. citizen, or to the nearest place where they can treat you according to Western standards. You want to make sure that you have enough of that insurance, because then we're talking, $100,000 possibly in that case. So all kinds of things to be aware of, but I'm a big proponent. I'd be interested to hear what Chip says.
No, I'll defer to the expert in the room. I think I'm a bit younger, and my personal travels have always been ad hoc. So I can't say that I've always committed to those ideals, but I think it's really important advice. And then to know what you're getting into matters. And insurance as a product helps you actually think about that and challenge yourself to think about the risks of travel, which you should. And at the end of the day, it will help you enjoy those things a lot better because you're not going in blind.
Right. I've seen many occasions, pro and con, good and bad, where people have either bought insurance and it's really helped them out of a bind, or haven't bought insurance and, they have tens of thousands of dollars at risk. Plus, they kind of have to get themselves to medical help.
Great. Thank you. We did have one additional question that kind of came in here at the last second. It's for either one of you if you feel comfortable taking it. And Amy, you mentioned the evacuation insurance. What do you recommend if you do get sick abroad?
Well, first of all, I recommend that you have insurance, and the answer to that kind of depends on where you are and what you have access to. If you're traveling with a group, you can pretty much count on that group to have resources in country to get you to the nearest best place. If you are on your own and you're in a country with which we have diplomatic relations, which is, most of them where you would be going anyhow, you can reach out to the embassy for resources, for medical help, for the nearest best experience. Closer to home, if you're in a hotel, most hotels are closer to the source. Many hotels have their own, relationships with medical facilities in the area. So there's a lot that you can do. But I think that if you're really in a bind, your embassy can help.
Great. Chip, any thoughts on that one or?
No, I think that's perfect advice. One thing I've been surprised about, I've been very privileged to both travel a lot on my own in the last few years, and then professionally with my company as we travel with our curators and our travelers, which has been great. But I've been surprised to meet so many people, including Americans, who travel alone, who don't know that off the top of their head. This might sound like, or I hope it is just default advice to people attending here, but especially when you travel internationally, knowing the local equivalent of 911, if there is one, knowing your embassy's phone number, having it written down and always in your pocket. These should just be things that you're preparing for. Registering with the U.S. State Department, to letting them know when your travel dates are. There are all these small things that I've just been surprised in my career. They're easy to do, but so many people always make them easy to forget. But they're small things. Travel emergencies can get handled just like other emergencies. The more prepared you are to handle them, the better off you'll be when hopefully they don't happen. But it's those small things and just knowing those pieces of information and having them with you. Also having copies of your passport with you at all times really helps.
Great, thank you. Actually, we did have another one question come up in the chat, and for either one of you are comfortable taking it. How safe are we in taking a cruise trip to Antarctica later this year?
I'll take that.
Sure.
Cruise ships, first of all of the major cruise lines do have plans to either start up or they already have started up. Some have already launched as of late May or now in June. And many of them almost all of them plan to be online and operating by the end of September. So there's going to be a lot of cruising out there, and the forward bookings, from what I hear in the industry, are really substantial. So that being said, cruising has looked like either this maybe the safest place to be coming back because of all of the protocols that cruise lines have been have put into place with regard to distancing, masking, the way meals are served, etc. It can also be looked at as a petri dish. And where if an illness does break out, you are in an enclosed community. I think it's probably going to be pretty safe going to Antarctica. Of course, you're not going to have a lot of people on and off during the cruise. It's going to be just that community, and there's not going to be a lot, in the air. So I think it's probably going to be pretty safe, with the exception, I believe, right now, of only one cruise line. Almost all of the others have a vaccination requirement. So, to Chip's point, it's as much to protect their crew and their staff as it is to protect the other travelers. You are really traveling in a bubble. So, that being said, that segment of the travel industry is perhaps the most strict right now in terms of vaccination requirements, and they'll have temperature checks and all kinds of swipes and constant cleaning, and if there is a case or two, they certainly can identify it earlier, not like where we were a year ago when they didn't even know what they had in their hands. And they can be they have protocols for isolating an affected individual or individuals at that time. They all have, sick bays now, I think, for COVID patients. So it's probably going to be pretty safe.
Great.
Best I can say.
Thanks.
What do you think, Chip?
Oh, I defer to Amy's advice. Sounds like a fun trip.
All right. Well, I want to thank our viewers for their questions today. I also want to thank, of course, Amy and Chip for their tremendous insight into this topic. We appreciate both your time and expertise. Thank you all for joining us today out there in our audience. Since our focus today was on travel, I would be remiss if I did not mention educational travel offered by Case Western Reserve. Siegel Lifelong Learning at CWRU offers national and international educational travel opportunities led by CWRU faculty. In late 2021, Siegel will offer 2 trips. One trip is to the U.S. Southwestern National Parks, and the other trip is to Egypt. Siegel has numerous trips also planned in 2022. There will be a slide posted shortly providing contact for Siegel Lifelong Learning. So thank you all very, very much, and have a great day. Bye-bye.
Thanks, Rob.